Hello everyone, I am Manga Saunishri from CSIT. Today I am here to talk about toward an integrated system of climate change and human health indicators, a conceptual framework from the course Disaster Management. Introduction. Climate change is one of the most significant global challenges that is impacting ecosystems, economies, and human health. It is rising temperatures, extreme weather events, and air pollution contribute to increased disease burdens. A comprehensive system integrating climate and health indicators is needed to access the risks, implement the policies, and mitigate the health impacts. This presentation explores a conceptual framework to a systematic track of climate change that affects on the human health. The objectives are and developing an integrated system for monitoring the climate change and its direct and its indirect effects on health, identifying the key climate and health indicators to access the risk and impact, enhance data driven decision making by linking environmental changes with health trends, support policy development to mitigate risks and strengthen resilience against the climate induced health threats, promote international collaboration in research and policy implementation. Climate change and human health, the link. What is the link between the climate change and the human health? Climate change leads to the rising temperatures, air pollution, water scarcity, extreme weather events, and ecosystem shifts, and direct health impacts. Heat stress, heat waves, increased mortality, cardiovascular and respiratory diseases. Air pollution leads to respiratory diseases such as asthma, cardiovascular diseases, etc. Waterborne diseases, contaminated water due to floods, droughts, or rising sea levels. Vector-borne diseases, spread of diseases like malaria, dengue, and Lyme disease. Indirect impacts of these climate changes on the human health are food insecurity, malnutrition, and weakened immune systems, mental health effects, climate anxiety, PTSD after disasters, and etc. are the indirect impacts that are caused by the climate change on the human health. Need for an integrated system. It is very important to have an integrated system which calculates the climate changes impacts on human health to access the risks um, in a determined way. The current limitations are fragmented climate and health data sources, lack of real-time monitoring and predictive modeling, policy making gaps due to inconsistent reporting. Why is an integrated system is needed? An integrated system is needed because it helps in understanding the complex interactions between the climate change and the public health. It provides a real-time and predictive insights for the early intervention. As always, as a saying, there is early intervention is very important in order to avoid the consequences of the health. Ensures the evidence-based policies decisions. Conceptual framework overview. Framework components. There are different kinds of components of framework that are climate indicators, health indicators, data integration, and visualization. The climate indicators are temperature, humidity, air quality, and extreme weather. The health indicators are disease incidence, mortality rates, hospital admissions, and data integration, combining the environmental and health data using AI and GIs. Visualization is like an insert of flowchart showing how climate and health data interact. Climate indicators, temperature trends, increase in average and extreme temperatures, precipitation patterns, precipitation patterns, changes in the rainfall intensity and distribution, air quality measures, PM2.5, CO2, NO2 levels affecting the respiratory health of humans, extreme weather events, frequency and intensity of storms, floods, and droughts, sea level rise, risk of displacement, contamination of waters. All these climate indicators are important to identify the climate changes and to um, collect the data of the trends in the temperature and the patterns in the precipitation and the measures of the air quality and again the weather events and sea level rise. Health indicators. Respiratory diseases such as asthma, COPD, and other conditions linked to the air pollution. As all these are linked to air pollution, health should be indicated by these. Weather-borne, vector-borne diseases such as malaria, dengue, and Zika virus due to changing habitats. Heat-related illness, heat stroke, cardiovascular diseases, waterborne diseases such as cholera, diarrhea due to contaminated water. They are all linked with the climate change and the mental health impacts such as stress, PTSD, depression due to climate related disasters. Data sources and collection methods. Climate data. The climate data can be collected by using the information from NASA, NOAA, IPCC reports, and other meteorological agencies. By collecting these kind of climate data is really important to find the patterns between the climate and the human health diseases that are related to these climate changes and the human health. The data, the health data can be collected from the world organizations like WHO, which is World Health Organization, CDC, and the local public health agencies can also be used to collect the health data of the humans. Hospital admissions, mortality rates, epidemiological studies are also needed to collect the health data. The integration tools like AI and big data analytics, geographical information systems, GIGs are very much useful in order to integrate and to analyze the data that is collected from the climate and health of humans and to find out the patterns between the climate and the health of the individuals and to find out what will happen next and to predict what happens by using this kind of climate data and health data. Analytical methods. There are some analytical methods which can be used on this data, such as statistical correlations, which is called as linking the temperature trends to disease rates. That means at which temperature does some kind of disease is occurring. By linking this temperature trends to the disease rates, we can actually control the number of diseases or we can stop the disease that is occurring from for a human. And AI and machine learning, nowadays AI and machine learning is ruling the world by predicting models for disease outbreaks. It predicts the disease outbreaks which is very important, and it is analyzing the disease trends and rates very fastly and is helping to calm down the number of diseases. And GIS mapping, identifying high risk areas for health interventions. Real time monitoring, IoT based sensors for tracking air quality, temperature, and disease spread. We can also use a real time monitoring such as IoT based Internet of Things based sensors for tracking the air quality, temperature, and disease spread of here is a case study one. The case study one is dealing with heat waves and mortality. Europe heat wave 2003, over 70,000 deaths, mostly elderly and vulnerable populations. This is because of the high temperatures which led to the cardiovascular and respiratory failures. From this, what we have learned the lesson is improving warning systems, urban cooling strategies. If we had the warning systems or urban cooling strategies, then we could have saved 70,000 people from death. Nowadays, it has been improved, but as pollution is on another level from that time to now, we must also improve our warning systems, urban cooling strategies. The case study 2 is vector-borne diseases, that is dengue fever in Southeast Asia. It is because of the rising temperatures expanded mosquito breeding grounds, increased outbreaks in regions previously unaffected, adaptation, improved surveillance and community awareness programs. We have to care about adaptation and also community awareness programs to decrease the number of vector-borne diseases that are associated with the particular areas where temperatures are expanded, where mosquitoes breeding routes are more. Technology and monitoring tools like GIS and remote sensing, which are used for mapping the climate and health trends. Wearable health devices such as tracking body responses to the environmental changes. Nowadays, everybody are using health devices such as smartwatch, smartwatches, which tracks the body responses such as the heartbeat, BP, and etc. These are used to track the body responses immediately to the external conditions of the environment. It even lessens the number of risks and actually gives the warning signals. IoT sensors, which measures the air pollution, temperature, and humidity. Big data analytics, combining multiple data sets for predicting modeling. Policy implementations. Governments also must be implementing early warning systems, develop the climate health action plans, strengthen health infrastructure, climate threats, and also international cooperation. WHO, that is World Health Organization, UN, United Nations, national agencies need joint strategies to eliminate the number of diseases or the different kinds of diseases that are being coming from the climate changes and weather changes. Challenges and the barriers. There are the data gaps, lacks of reliable and standardized climate health data, technological limitations, high cost of advanced monitoring systems, political and economical constraints, limited and funding policy resistance. Proposed solutions can be included as data standardization, that is by using unified platforms for climate and health monitoring, public private partnerships, that are collaboration in research and innovation, education and awareness, training of healthcare professionals on the climate risks to the people beforehand. The future directions can also include the AI-based forecasting models, smart cities and green infrastructures, international climate health networks. The key takeaways also includes the climate change has severe multi-phased impacts on human health. Integrated climate health monitoring system is crucial for prevention and adaptation. Technology-driven solutions can help policymakers make informed decisions. And here we comes to the conclusion. Climate change is a major health threat. Rising temperatures, air pollution, extreme weather events, and shifting the disease patterns are significantly impacting the global health. There is a need for an integrated monitoring system which combines all the health data, the rising temperatures data, the weather data, and to identify the different types of patterns among these combining climate and health indicators through AI, GIS, and big data analytics provides real-time insights and predictive capabilities. Policy and infrastructure development is crucial. Governments and organizations must invest in resilient healthcare systems, early warning mechanisms, and sustainable urban planning. Technology and innovation can drive solutions. Advanced tools like IoT sensors, remote sensing, and AI driven forecasting models can improve monitoring, prevention, and responsive strategies. Global collaboration is essential. Addressing the climate related health challenges requires coordinated efforts across countries, scientific communities, policymakers to share the ideas, resources, and solutions. Thank you for giving this opportunity.